Hello, Lieutenant Governor Kathy Hochul. Thank you so much for joining us on Life Before the Virus.
I'm happy to be with you and looking forward to our conversation.
So tell us how your role as Lieutenant Governor has changed since this pandemic.
Well, it's changed in certain ways and not changed in others. What I did before was really be the voice of the administration in terms of connecting with different elected officials, constituency groups, whether they're clergy groups, small businesses. I've always been the one who went out and told the story of our great initiatives and what we're trying to accomplish. And so what this role has done has also allowed me to continue in that with the relationships I've built all over the state of New York, but to really focus on the public health aspects and how we're going to manage getting through this crisis, working in partnership with Governor Cuomo and our entire administration. So it still gets me doing daily FaceTime or video chats and Zoom teleconferences with everybody from the North Country Chamber of Commerce yesterday to statewide clergy to speaking to people in the Department of Corrections today. So I'm in touch with the administration, the commissioners, their teams, what they're doing, as well as people locally. So I think in that sense, I'm just communicating in a different way. I'll tell you one thing is I'm spending a lot less time in airports and in the car. So I normally would be touching all these people and visiting all 62 counties every year. And now I'm visiting all 62 counties virtually. So I'm probably one of the first to accomplish that. I'm going to try and hit all 62 before this pandemic is over to make sure every part of the state knows that we're focused on them as well.
Right, so it could be that you're having more conversations than you would normally have because it takes less time without the travel.
You can really hit larger populations when you get on a call and they say, well, now there's 1,000 people on this call from this region. Well, it would have taken a lot longer to see 1,000 people in certainly the more remote areas, or even last night being able to be on a phone call with on News 12 and answering questions from people in the Bronx and Brooklyn. I mean, that's something that I would not have been able to do in the past. If I can be a voice of calm and provide up to the minute information based on what we're telling the voters and the constituents on that very day, that's important. I think it's important that people know that, we're just staying connected. And if I can amplify the governor's message that he gives so clearly every single day, and everyone should be tuning in to watch this if you want to know just the facts and where we are as a state and where we're heading. That's a great template that I'm able to go talk about that more regionally to different constituencies and different regions of the state. So it's really been a great team effort. And I think you're right. I do have an opportunity to speak to more people through these medium and various using technology and like this, like Instagram, and reaching out to people. So it's an interesting dynamic. I miss the personal touch, but this is a very good substitute. It's working well.
So with New York as the epicenter, what resources are available to our state that other states may not have access to?
Well, we were very upfront with making sure that we had unemployment insurance available. We just announced that we have been able to allocate $2.2 billion to people who apply. Now, a lot of people are still waiting. I understand that frustration, but that's far more than any other state in the nation. So we really ramped up our system. So that money's available, making sure that people know about small business money that's available through the federal government, but the state has been a great partner, making sure that it gets out to the communities to help people, even small businesses, entrepreneurs, sole proprietors, someone who just runs a small business that never was eligible for unemployment insurance, or someone who works part-time or drives Uber. So, people that were not eligible are now eligible. So I'm giving a lot of information about money for small businesses to people directly, as well as just having a hotline that's available for people to ask questions about their symptoms and what they should do and should they get tested, and also an emotional health hotline, because we're realizing that this is taking a huge toll on New Yorkers. I mean, we're tough, but we're not immune to not just the disease, but also the psychological impact that this has from turning your everyday life and routine upside down. And to have the compounded stress of losing a job, perhaps, as many have, or just worrying about the fact that you're trying to work from home and expected to be productive, but you've got children who otherwise would be in school. The stress on our families, as well as the loneliness. I mean, individuals who are so, we're social animals. We're used to interacting with each other, either in a bar at night or a restaurant or in the workplace, or for senior citizens who've been isolated to protect them from their families and loved ones. This is really taking its toll on New Yorkers. And so there's no shame or stigma associated with anybody calling our emotional health hotline. And if you can help us get that number out, I think that'd be great. We'll make sure that's available. And we have 8,000 volunteers, people who are healthcare professionals, mental health professionals, who say, you know what, we're going to give our time to help others. And sometimes you just get out of bed, or you can't even get out of bed, say, I need help today. I can't get through this. It's too overwhelming. It's just crushing. Pick up that phone and have someone talk you through the day. And you might just feel a lot better. And if you're fine, then pass that number on to somebody else.
That is a wonderful resource. So I'll make sure to get that and post about that. So while most men they contract COVID, most men contract COVID, but women are more affected because of the amount of healthcare workers that are women. And as you mentioned, that are now home and dealing with kids that are not in school. So could you talk a little bit about how women are disproportionately affected by the virus?
They truly are. And I wrote about this weeks and weeks ago at the very advent of this, when I realized that we are so reliant for our staying alive on our healthcare workers. Well, who are these healthcare workers? Who are the nurses and the technicians and the aides and the people that are even cleaning the hospitals and making them secure for us in terms of disinfecting? Who are these people? Turns out that 76% of them are women. The vast majority are women. Many of them are single heads of household or trying to manage home life as well. So at a time when many people have the ability to stay at home and protect themselves and their families, these women are suiting up for armor and heading into battle every single day. And they are tough, but not just in the healthcare field. Look at the people that are behind the grocery counters when you're in there at the cashiers, or people that are helping you in and out of a pharmacy. Who's taking care of you? Primarily women. And the sad news is that 2/3 of minimum wage workers are women. Either they're out there now on the front line as essential workers, or many of them have lost their jobs. Many were waitresses. I was a waitress for a long time and relied on tips. That money's gone. So they're really taking it on the chin financially, as well as the emotional stress of worrying about their children. If they are working, who's taking care of the kids? And so I'm really proud that we've been able to have a program that helps frontline workers be able to get assistance to cover their health care or their child care costs. That's brand new. We just announced that yesterday. But I think we need to rethink the role of women in society and their value and how it should be elevated once we come through this crisis. And I think we just have to point to the spotlight on them now and say, look what they've done. Look how they've been the ones who helped manage this and get us through this. And without them, where would we be?
And now looking forward to reopening and reimagining New York. And I know that you're going to be leading that effort for the state. Can you tell us a little bit about what that looks like?
It'll be driven strictly by the health numbers in terms of the number of new cases. Are they continuing upward? Are they flattening? Are they declining? Hospitalization rates. And so what we're realizing is there is a difference in the impact in terms of geographic areas. Upstate versus downstate. We don't want to pretend there's a divide, and we always talk about one New York, and there truly is. But when it comes to how the pandemic has hit us, it's been obviously much harder in the downstate area. So we want to talk about strategies that allow parts of upstate that have not been hit, that can manage the crisis because the hospitals have been able to keep a lot of beds available, how they can open slowly and smartly, and making sure that we have a strategy to protect clients and customers and as well as their employees. So I'm working on that dynamic now. We're not ready yet to launch, but at least the conversations are going on. But you mentioned Reimagining New York. This is a great opportunity for us. When you think about how we had to rebuild after Hurricane Sandy, we built stronger structures. We built resiliency into our energy system, or how we rebuilt Manhattan after 9/11. It came back stronger and more vibrant than ever before. That's what we want to do for all of New York. And look at society and our workplace and what way we can reimagine to do it even better for the benefit of our residents. Think about the workplace, working from home. This was viewed as a luxury to some. Wouldn't it be nice if I could just work from home and be just as productive? This may be the new reality for many individuals when the employers say, we're not quite ready to open with everybody. Let's try this for a few more months. And people may say, I like not having to worry about a commute. I can add 2 hours to my day, not having to dress up and get ready to go out in the workplace and take the subway and the train and the bus and then have to walk. There could be more hours back in people's days, and how much that would increase our quality of life. It's extraordinary to think about the possibilities. But what new industries should we be talking about? What new businesses? I, for one, might want to make sure that we have plenty of ventilators and protective equipment and masks and gowns and reagents for testing. And I want that made in New York. Why not make sure that we can find opportunities to get people back to work in industries that we wouldn't have even thought of before? And that's just scratching the surface. If we think about telemedicine, telehealth and how we can be delivering more healthcare, better outcomes to people if they could just pick up a phone and do FaceTime with a doctor instead of putting off that annual visit every year like many people do. We can be healthier, we can be more educated, creating opportunities for people that have been underserved before if they can get that connection to the internet, which is I don't assume everyone has, but those who have it can have online learning more available to them. So this is actually an exciting chapter that we're embracing, as well as just taking care of public health every day. So there's a lot going on, but it's truly an era that we'll be talking about for the rest of our lives, without a doubt.
And it's so refreshing to speak to someone with such a positive outlook on this. So thank you so much for all that you're doing for the state of New York, Lieutenant Governor, and thank you for taking the time to speak with me.
Thanks for having me on. Bye-bye.